My name's Bourck, Cashmore. I'm an orthopedic surgeon here at Northern Arizona Orthopedics. I specialize in hip and knee pain. I really treat the spectrum of problems you can have with hip pain and knee pain. So, usually I hear from patients that, they tell me, well, I can't go for hikes anymore, or I can't sit in a car for very long, and they come in and maybe they haven't had any treatment before. We're able to get an x-ray. I can help determine if it's a soft tissue problem around the hip, like the labrum, or determine if it's more just wear and tear or arthritis. We definitely have treatments for arthritis that aren't surgery. Therapy can help. There's sometimes injections that can help. But a hip replacement is a great option for patients who get arthritis and aren't able to do what they want. Some patients will come in and think, oh, I need a hip replacement, and it may end up being bursitis or tendonitis. And we've got all sorts of treatments for that. I had a 90-year-old patient who had an elective hip replacement. And I know we've done hip scopes probably, 14 to 16 years old. It is a wide spectrum of patients who have hip pain, and it's obviously not the same problem for each patient. Here, we always put the patient first. And so, a patient may come in and they have hip pain, and I examine them, and it turns out they've got a back problem. I know I've got two back experts right down the hall that I can send them to. Or I can refer them to physiatry. Maybe they can get injections and have treatment. So we've got really the whole body covered here in the office. When a patient comes in, we're able to say, we want to treat the whole patient, not just this one spot. And so we've got a unique situation here that is really fabulous for Northern Arizona.